set of recommendations about how much they ought to pay for Medicare. And they get it from people who provide health care, from doctors, hospital administrators, people who run clinics, people who deal with the challenges that seniors have who are on Medicare. And they recommended some changes in reimbursement that would cost Medicare over 10 years, $716 billion less, and have the benefit of adding 8 years to the Medicare Trust Fund, so it would give us till 2024 to bring our overall health costs in line with inflation, and we wouldn't have to deal with this whole voucher thing that the Republicans are advocating. Because that's what it did. The AARP endorsed these savings. Do you think they would have endorsed these savings if they were going to throw 25% of the Medicare Advantage people into the street? No. Okay, so that's not so. But I got another test for you. Here's what Medicare Advantage does. If you enroll in Medicare Advantage, the government pays them a little more than they spend on typical Medicare to spend some more money on the seniors enrolled in it for preventive and primary care. And the theory is they'll stay healthier if you do that, and they'll cost less. So someday, the payment for Medicare Advantage can be exactly the same as it is for everybody else on Medicare, and the people insuring Medicare Advantage should actually make more money because the people will stay healthier, right? But when they started, they subsidized the program. When this started under President Bush, and here's how much it was subsidized at the beginning. Every insurer got $1,100 to provide $600 worth of preventive care. Now, nearly all of you would do anything that wasn't illegal or immoral for an 85% markup, wouldn't you? Nearly any business in this county would kill for an 85% profit margin. Okay, so over time, as more and more people got in it and they got comfortable, starting when President Bush was in office and the Republicans had the majority in Congress, they began to cut the profit margins, according to advice from professionals. The last report came in, and the White House, the President, and the Department of Health and Human Services and Congress followed that advice. That's it. And they needed to do it because with the baby boomers coming into Medicare, they needed to add 8 more years to the life of the trust fund so it wouldn't go broke by 2016. Now, that's all that happened. Now, you heard Governor Romney say 25% of people are going to get kicked off. These cuts have already started. They're not cuts, they're smaller increases. So what happened last year? They already started. Here's what happened. A record number of insurance companies applied to offer Medicare Advantage. 17% more seniors than the year before are on Medicare Advantage, and the cost of being on Medicare Advantage for them in terms of their co-pays and deductibles went down 16%. This is working just fine. And what they want to do is repeal it, which would have the effect of reopening the donut hole in the senior drug program, costing people on average of $600 a year, and going back to having the providers get more, which would cost the seniors more, and taking 8 years off the life of the trust fund so it goes broke in 2016 instead of 2024. And then they'll make a big push to say, oh, I'm sorry, we've got to turn it into a voucher quicker than we thought, which is a bad idea.
Yes.
Why? Because the problem in America's budget on health care is the inflation in health care costs, not the inflation in Medicare. Medicare has lower inflation costs, lower administrative costs, and lower inflation rates than overall private insurance does. So this Medicare thing is a hoax, pure and simple. What they want to do is go back to spending your tax money on what amounts to corporate welfare because the profit margins are not necessary. We're getting more people than ever before in the program, and they're paying less for it.